Okay. Good morning, everyone, once again. So, today's session is on men's mental health, and we do not have too many participants. That is why we are recording this session so that we can share to few of them who has reached us out saying that they are having some technical issues and they want to join but still they are not able to. So never mind, we'll start the session. So today is 29th of June 2024, Saturday, and I'm from Nepal. So wanted to give you a very interesting fact about today. So here in Nepal it's 15th of Asar 2081 according to Nepal calendar, and today it is known as Paddy Day. Uh, it's known as a day where all the farmers, where all the people of Nepal, they go to their field, farm, and since it's a monsoon season, they what do we call, plant some kind of crops. So everyone is in their field and it's a monsoon season, it's raining, and they play with the soil. They have a quality time with their farmers, friends, and family, and have a food that is known as beaten rice and curd. So today is a very special day here in Nepal. I wanted to give you all a short information about that. So moving forward, so regarding men's mental health, so you all know that June. This is the month of June, and in a lot of country, especially in United States, uh, this month is celebrated as men's mental health. And in today's session, we'll be discussing in very short about why men's mental health is important and in what way. So first is, you all might be thinking like, what is, men's mental health? Second might be, what are the mental health issues and illness, since we are talking about their mental health. Then other is like, what are the different issues of different communities in men. So this might be a little bit of tricky word, so we'll be discussing about this as well. Then what are the challenges especially men face in terms of health, mental health, physical health, and many more. Then why is it important, we'll also be discussing about that. Then since we think about men, we already think like, it's a societal expectation and impact, and how does societal factor affect them. So we'll be discussing about that as well. Then we'll also be discussing a little bit about what are the supports and services available for them. Okay. So today we had scheduled for breakout room sessions, three breakout room sessions where we wanted to engage our participants into several questions where they can communicate and discuss about men's mental health first. Then only we wanted to jump into the brief information. So since we'll not have a breakout room now, what we will be doing is I'll be sharing question one by one. So what we all can do is, in very short in the chat section, you can add your answers so that there is a short interaction in the chat itself, and it will be a brainstorming for yourself about those questions. Okay. So I want everyone to participate. Others, Maria, Samir, then we have Sahid as well, and Tangila as well. So, it's a very short session. So, requesting you all to, participate in the chat box. Okay. So, first question for everyone is, when you think about men and their health, what do you think are the challenges and factors they face affecting their mental well-being? So, in a very short, whatever you feel like, you can answer those in your chat section. Anyone who wants to share, what are the challenges and factors affecting, men's mental health, you can write it in the chat box. No one?
Okay, Situ,
I
I'm
guess you all are
writing, or I can
writing.
also say,
Sorry?
I'm. Should I write, or I can also say?
Yeah, yeah.
I
If you
was
are
right.
comfortable speaking, yeah, Samir, you can speak
Yeah.
as well.
Okay. So there are a few reasons that are the cause or challenges. I would like to say that is one is the traditional uh, expectations, because men has this traditional masculine ideas. They have to be they cannot share their emotions, they will become weak, and society has like put this type of pressure with them, and they have to be always strong and everything. Another thing is stress, because in Asian countries, I don't know if it's all Asian country or not, because of the job pressure. It's mostly the men who earns for their family in Asia still, so they have a significant stress to manage everything on their own. And another thing is because they cannot share, men cannot share, or they do not have any support system. They are not very much used to sharing their pain, because they think that it might make them feel weak. So these are some points due to this uh, men's mental health gets affected.
Yeah, very true, Samir. Thank you so much for your input. So I can see Maria also has addressed few uh, challenges. So she says that bread earner more responsibilities on their shoulder stress them out. Very true. And second is men cannot cry as they are considered strong and brave in the society. Very true. So these are some of the bold reasons why men have a challenge, and one of the greatest factors. And others also writes that work pressure, relationship issues, and poor physical health make it harder for men. So very true. Not just the societal what do you call a responsibility, they also have a very poor physical health, so we'll discuss about that as well. And Shahid from Afghanistan writes that here in Afghanistan, as you better know, that Afghanistan is a war-torn country. In every 120 years came new government with strict rule policies. Very true. So this is a very interesting and important factor as well. Like most of the war countries where there is a lot of conflict, men health, both mental and physical health is really destroyed, and new government not given the men's right. So very true. So thank you for sharing your thoughts. So let's move to another main topic, that is I want to know from you all, like we are talking about men's mental health, and from your perspective, from your eye, from your lens, what do you think, from your surrounding, what are the symptoms men show when their well-being is affected? So I can see a lot of you know male present here in today's call, so you can share some of the symptoms men show when their well-being is affected. So let's discuss about this also in a short way.
Can I share?
Sure, sure,
So,
Samir.
yeah. So, men shows their when their mental well-being is affected. First, some men shows anger. Maybe they get irritated, or they show more anger. But inside they have maybe sadness. Second thing is they tend to stay alone. they tend to stay alone. It can be another symptom. And these two is coming on my mind right now. And yeah, these two. And if I have any other, I will write in chat.
Yeah. Mhm. Sure, Samir. So very true. Some of the main symptoms that men shows is their aggressiveness. So which is true, and another is aloneness as well, loneliness. So others also writes the same, like anger, self isolation, leading to substance use and loss of interest on everything. Yeah. Then Maria writes frustrated, anger, keep things on themselves. Yeah, very true. So let's move quickly to another interesting questions. Okay. So another question we have is, how can we build support and effective coping strategy for men's health? What do you think? Like, what can we do to support and have a effective coping mechanism for our men's mental health? Or if you have any kind of practices in your respective country, then you can share that as well by creating safe space. Others.
I think in Bangladesh, we do not have particularly for men, but there are support group discussions regarding
Hmm.
mental health. So maybe these short support group discussions can be done. That is number one.
Uh,
Number two, the techniques that are used for normal mental health thing, for example, a lot of things. It can be mindfulness, it can be
hmm.
meditation, it can be some other techniques such as how to like forgive. These type of various topic sessions.
Hmm.
It can give them some uh, idea, as well as maybe uh, m- because men are so busy and they might think that okay, this will not help, they will not give time. This can happen. So to actually uh, engage them that okay, this is very important.
Hmm.
If someone they like, or someone they like, or uh, have strong influence, if they can say, for example, it can be any men likes cricket, maybe through cricketers, if they talk about mental health, or if some important people talks about mental health, they will take it seriously. Because
Hmm.
even after, if we do all those coping strategies, they might not go there because they so busy, or they might
Ah,
feel that this is not needed.
yeah, true. And it's great. It's really great information to know that in Bangladesh there are, group support for men. So that is really interesting. So, Maria, you're raising a hand. Over to you.
So I would like to give example from recent M4M ambassadorship program. So in this M4M ambassadorship program, we went to the people who are affected by drug addiction, and most of them, like all of them, were men. So what we did personally to support them and to have effective coping strategies for their mental health. So
Hmm.
first of all, we had same gender, like the speaker was same gender, like um, we know it very well that men usually don't open up in front of female or different gender. So we had
Hmm.
same gender so that they were easily able to
Hmm.
open up with them
Yeah.
instead of yeah. So that's one thing which we did in our session. Also,
Hmm.
we had this meditation thing which Samir shared also, like we taught them about this deep breathing exercise. We tell them how to feel their inner self, and we found that they usually don't open up easily now. So what
Mm.
we did, we played video for them, and through that video we asked from them that how they're feeling, like how they're resonating from this video. So that's how they shared their feelings, and even
Mm.
they shared their feelings with the help of art therapy, rather than talking, and rather than speaking. They just did they shared their feeling, they shared their status of mental health by other activities. So yeah.
Yeah, 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 Maria. So even I do remember, and this is really, effective. We have been seeing this approach are very effective, especially for men. So thank you so much for sharing that. And what Samir's shared and what you shared will be coming to that as well and share more about it. And I can see Shahid has also shared few things like we should start physical course about mental health and well-being along with online monthly series. I know here in Afghanistan will be a big challenge as you know the Taliban government not believe on. Okay, yes, very true. And others also writes that open communication and encouraging them to talk about their feeling. And yeah, art therapy really sounds good. So yeah, this is one of the approach that most of us are using right now in most of the countries because it's one of the a kind of narrative counseling, and it has shown a very positive sign, and there is a good positive impact as well. So um let me move to another slide. So this is all the thing that we shared. So thank you everyone once again for your sharing and interaction. So even if we are in small numbers, thank you for the interaction and sharing your thoughts. So now without taking much time, uh, we want to share you some major information about men's health. So at first, so like whenever we talk about men's mental health, we only generalize, like we only think as a male perspective. So it is very much important for every individual who are interested to talk about mental health, know about mental health, and are focusing on men's mental health. We also should focus and include cis men, trans men, gay men, poor men, and disabled men. So they are also men, and it is very much important that we should prioritize their well-being as well. So this is the first thing that we wanted to share. Second thing is, as I mentioned earlier, so this is the month of June, and if you go to the Google and any research site, you will be confused a bit. Like in some of the sites there are men's mental health awareness month is celebrated either on June or November. So yes, annually on the month of in the month of June and November, mental health for men are celebrated, and especially in US, in the month of June, men's health awareness month is celebrated as because we also have International Father's Day. So that is also why. And based on different countries, this men's health is taken as a a priority, and the main focus is to raise awareness of the importance of mental health among men and to encourage them to speak up and seek support for their mental health issues. So this is the major main thing why we observe and prioritize as men's mental health awareness month. So giving few datas, if we see at the data available, what we can find is only in America, there are over like 6 million men affected by depression each year, and half of them don't even seek help. So this is a major issue that has been seen in the United States. And the second thing is, since we are from South Asia, I got to know that our research, our data is not yet enough, not even concrete to share. However, we can say that, in South Asia as well, the men's mental health is not given as much as priority as it should be. And overall, it has come to know that, men's are 4 times likely to die by suicide, and 80% of them are all by, suicide death. Then another is more than 4 times, it started from 2019 that, more than women 4 times men, commit suicide, not just in US but in overall. So that is also something a very alarming thing. And since we are talking about, trans men, gay men, queer men, it has been, data has been collected that, in the very early age, before the age of 25, these, gay men, bisexual men are more likely to develop mental health disorders. And you all know why is it so, because of the societal factors and all. And due to these disorders, they increase, the increase of suicide rate and self harm has also increased. Another important, data that we wanted to share was, since everyone, you all share that, what could be the um, factors, affecting their well-being and symptoms. And most of you all mentioned that, using of, alcohol, you know taking wrong path. So it has been shown that, in every in 5 men, 1 man always suffer from alcohol abuse during their lifetime, as they consume alcohol as a coping mechanism. So this is also another, alarming data. Then in, relation to this alcohol use and abuse, it has been seen that, more than women, like 2 times, they develop substance use disorder. So use disorder means, like use of alcohol, smoking cigarette, using weed, a drug, and many more. And last but not the least, it has shown that, in every 10 men, 1 man experience depression or anxiety. And as mentioned above, more than half do not even, seek any support or treatment. Okay, so that was the few information that we wanted to share about men's mental health. So moving quickly for this challenge and factors that you all shared, want to give you a few more. So going one by one. So everyone shared. So we all know we belong from South Asian country, and overall, in the global context also, men's major factor that, affect their well-being is because of the societal expectation and masculinity norms. And this is one of the major factor. The second factor is, the issues that they face, that is depression, anxiety, and stress, which is unseen, and they do not even seek help for them. Third major, challenge and factors that men face is, because of their sexual orientation and gender identity. So as we know, we already have a very stigmatized and discriminated culture. And on top of that, when there is, when a person or individual is trying to own their own identity, there comes an issue. So because of sexual orientation and gender identity as well, a lot of men, especially trans men, gay men, and queer men, affect their mental well-being. Fourth thing is, personal experience and coping mechanism. So, as mentioned above, men already have a lot of, expectation from the society. so and from their family itself. So it becomes a kind of challenge for them personal from the personal level, which makes them hard to cope their understanding their feelings, their uh, challenges and many more. Other major factors is societal expectation as mentioned above, and along with this we also have like cultural and ethnic factors. So I wouldn't say in other like western countries, but in south asian country you can see that we are so much diverse, and our culture and ethnic factors make men so pressurized that they that becomes one of the biggest challenge and factors affecting their overall health. So I have added few lines here so that it would be easier for everyone to understand. So what do we actually hear in our household and in our community is we said to men that okay, you are a man, right? And you should be strong, you are the head of the family, you cannot be weak. So these are some of the simplest sentence that we hear time and again, and because of this smallest simplest sentence, it becomes a huge burden for men. So from this only we can we ourselves can uh, generalize and think like how men's would feel that okay, sometimes they might be weak, sometimes they do not want to be, but our culture and societal expectation pressurize them to do so. So another major thing is emotional suppression. So uh, you all also share that Mari also shared that we say to men, or we can see people saying to men that okay, you cannot cry, you cannot be emotional. So this is also a kind of emotional suppression that we can see in our own society, because of which it becomes a challenge for men to express their feeling and all. Another is family pressure, duties, responsibility, work and financial stress. So I need not to elaborate these things, but you might be you can understand that these are some of the major factors as well. Then another is substance use, substance abuse. So these are also some of the major factors. So in our culture we can see that use of alcohol, smoking is like a trend, it's a very important thing. So if you don't smoke, then okay, you are not a man. So this is a fact. So because of these things also it becomes a kind of a factor affecting their overall health. Then another last is like health issues and barrier to access support and health services. So as mentioned above, we already say that you are a man, you are strong, you are the head of the family. So if a person is a head of the family, how can he go and seek help, right? How can he say that okay, I need help? So because of this societal barrier, or what, not barrier but thing only, uh, they cannot access support and health services. So this also becomes one of the major challenge and factors affecting their health. And last but not the least, as Sahid mentioned in our previous interaction, that uh, Afghanistan faces a lot of conflict, and in many South Asian countries also we can see so many conflict going on now, not just in South Asian country but in the globe. You can see a lot of conflict going on, and if you see the data, men's are mostly affected, and PTSD, that is post traumatic stress disorder. So a lot of men go through this mental health illness, and that is all because of the violence and trauma they have faced. And this is also one of the major factor. Okay, so these were some of the major factors affecting men's health. So quickly going to what are the symptoms that men shows when their well-being is affected. So first thing is, everyone mentioned it already, like emotional symptoms like getting angry, getting irritated, getting sad, lonely, triggered. Second is, behavioral symptoms like, the person starts to isolate themselves, substance use, since they cannot share their feelings, change in daily activities and habits, and risk taking activities. Then other is physical symptoms like being very aggressive. So you can see men getting very aggressive, substance use, fatigue, weight changes either by losing weight or gaining weight. So most of the time we think that a person might just lose their weight, but it's not the case. Some of the men or some of the other individual as well, they gain their weight. So that is also one of the biggest physical symptoms that can be seen. Fourth is negative thinking and difficulty in concentrating. Then relationship problem, distance from friends and family, work performance issues, and reduce in sexual desire and sexual dysfunction. So this is also one of the major symptoms that can be seen on men, and we can understand that they are having some issues. You know? Then other is self harm and injury. And last but not the least, they will do some activities risking their life. Okay, so these were some of the major symptoms that we can see. And now last topic, that is building support and effective coping strategy for men. um, as you all share that group discussion should be done, and mindfulness practices should be done, and support system or groups should be built. So adding few on those things, the first thing is like reduce the stigma and promote open communication. So we all know that our community, our society is so stigmatized. We have so many stigma and superstition, so we should be reducing that very first. Second thing is we should promote open communication, where we should engage men and talk about it. Then another is increase awareness and education along with supporting pair members. So this should be also done, and it's great to know from you all that there are some kind of awareness in your respective country. Then third is access to resources and services for counseling, helpline numbers with safe space, which is very much important. Introduce physical activities program recreation in workshops. So this is one of the most important, I believe, that everyone should know in today's date, is that everyone is working, and every workspace should change their policy and introduce physical activities program and recreation for men, because already in their family and society they have so many of expectation that okay, you should be doing this, you should be doing that, so they do not have much time for themselves. So after home, workplace is a place where they work, they interact with their workmates and all. So these kind of physical activities and recreational programs should be there, so that men's can feel themselves and take care about their well-being and have a very fun time. So this is also another major support that we can give. Fifth is address substance abuse by creating support program and education. Okay, so this also, like as Maria mentioned, and in our other program also, like we have separate sessions for people living with HIV, LGBTIQ people, and many more, people with disabilities. Uh, we can see that they face so many challenges. So, and while they are facing so many challenges, they tend to use substance, like using alcohol, smoking. So uh, there should be a support program. There can be many, like we share like art therapy, music therapy, and many more. so that people who are going through hard time can understand the effects of substance use and also find a support system. Then we should also be introducing a safe and encourage to seek help and also make them participatory. So this participatory means, like, for example, this is a very simple example, like, uh, I don't know if it's relevant or not, but we should be making men participatory in every session. For example, it's not related to this, but when we are talking about menstruation, men should also be there. When we are talking about abortion, men should also understand why abortion is required. When we are talking about pregnancy, they should also know about what are the changes that a woman face and what are their responsibilities and how can they cope with it. Because a woman and men or trans people go hand on hand uh, with life changing thing. So it's very much important that all the sessions, all the programs should be participatory, so that they are included and their part of views can also be heard. And last but not the least, we should be reducing the stigma and the old culture. So, old culture is a new word. Stigma has already been mentioned above, but still, like, old culture should be omitted, and people should be aware that okay, this is just a stigma and old culture, so we should not be following that, and take new steps. And lastly is this was we got to talk about this earlier as well. So we should also engage in policy advocacy by advocating for change and community involvement. So this also has been one of the important effective coping strategy, that there should be policy change starting from a workspace where men's health is also prioritized, and do advocacy in changing the uh, stigma, and community involvement. Okay, so this is all. So these are the three major topics that we wanted to share with you all. So we won't be taking too long, and we want to know, after all this sharing, is there anyone who wants to share a few words, like, if I have missed anything, and the floor is open. If you have anything, you can unmute yourself or simply write it in the chat box. Anything that you want to share after this brief presentation, like, if you have anything, like, okay, uh, this is also something that we can do. So if there is anything, then you can just unmute yourself and mention, or you can simply what do we call write it in the chat box, so that we can read it out from there. Okay, Hasim. Okay, hello Hasim, welcome. Hasim writes it's an informative session sharing. Thank you, Maria. Thank you, Samir, for your kind words. And what is there else? Okay. So I see no one sharing. So I guess this things has been pretty covered. And while I was also researching about this men's health, men's mental health, I realized that from my personal level that there isn't uh, proper data uh, for men. So it's a high time that a more research should be done for men's mental health and overall health. First thing. Second thing is as I was researching, I found that there aren't much videos. I wanted to show some videos related to men's mental health, and I found that there aren't such relevant videos in relation to men's health. So that is also second thing that I believe that we should be focusing on. Third thing is still there is so much of stigma and challenge that men face. And even if we know that they are having a hard time, they face problem, a proper what do we call, like, promotion is not being done yet. uh, Even if there is a month given for their health, health awareness and all. So while researching, I was thinking those things. So those things should be done. And after this session, I believe that you all will be going back to your community, to your family, friends and family. So one small thing that you all can do is you need not to do big thing. So you can go home, or you can simply ask your parents, ask your father, like, how are you doing, a simple thing like, I want to share what I do. Like, whenever my father comes back from the office, what I ask him, like, what did you eat, what was the snacks, how was your day, so these might sound very simple thing, but if we ask this kind of small thing to our parents, our brothers, our father, our a partner, then that becomes a small gesture as a support for them. And we can start through a small step, helping them and supporting them and being a safe space. Okay. So wanted to share this as well. And after this, I can see a lot of you are involved in our community support, so you all can go and share to your community as well, like, why men's mental health is important. And the recording will also be shared from our YouTube, so later on you can go, you can check, and you can share with individual who are in need and wants to learn about it. Okay. So last but not the least, once again, thank you so much for joining the session. As mentioned, a lot of country here in Nepal also, we are using what we call data and joining the call as it's a monsoon season. And thank you once again for joining the session, even if we are less in number. And uh, requesting everyone to, if it's possible, you can turn on your cameras so that we can take picture. And what was about to say is, what was I about to say? I forgot. I forgot. I forgot. Okay. So thank you once again for joining the call. Adarsh will be taking the picture. So if you are fine, you can turn on the camera and we can take the picture. And with this, once again, thank you for joining the call. Stay safe as it's a monsoon season. And here in Nepal, there is so much of flood and landslide going on. So take care of yourself wherever you belong, and you know stay away from mosquitoes as well. And thank you once again. Adarsh, are we done with the pictures?
Yeah, almost.
Okay. So thank you everyone once again for joining the call and being part of the session. Bye bye.
Bye bye.